What is the first aid treatment for a snake bite? Your options: apply a tourniquet, wash the bite area with soap and water, immobilize the affected limb, suck out of the venom. The right answer is immobilize the affected limb. Immobilization helps to slow the spread of venom through the lymphatic system. What is the main function of red blood cells, RBC? Your options: transporting oxygen, fighting infections, producing antibodies, or storing nutrients. The correct answer is A, and that is transporting oxygen. Red blood cells or erythrocytes primarily function to transport oxygen from the lungs to the rest of the body. What is the primary purpose of a sling in first aid? Your options: immobilize a broken bone, stop bleeding, provide support for a sprain, or administer medication. The right answer is immobilize a broken bone. A sling helps to prevent movement and supports a fractured or dislocated limb. Which of the following should be done for a minor burn? Your options: apply ice directly to the burn, pop any blisters, cover the burn with a sterile non-stick dressing, or rub the burn with a dry cloth. The right answer is cover the burn with a sterile non-stick dressing. Covering the burn helps protect it from the infection and promotes healing. In medical terminology, what does ECG stand for? Your options are electrocardiogram, external cardiac graph, electronic cardiovascular gauge, or echocardiographic. The correct answer is A, that is electrocardiogram. ECG records the electrical activity of the heart over a period of time. What is the primary purpose of an IV cannula? Your options: blood pressure measurement, medication administration, urine collection, or oxygen therapy. Correct answer is medication administration. IV cannulas are commonly used for the direct administration of medication and fluids into the bloodstream. What is the main function of the small intestine in digestion? Your options: water absorption, nutrient absorption, protein digestion, or storage of waste. The correct answer is nutrient absorption. The small intestine is where the majority of nutrient absorption takes place. That includes protein, fats, and carbohydrate. Which organ produces bile for fat digestion? Your options: stomach, liver, pancreas, or gallbladder. The correct answer is liver. The liver produces bile, which is stored in the gallbladder and released into the small intestine to aid in fat digestion. What is the initial treatment for a person experiencing a seizure? Your options: place a spoon in the person's mouth, hold the person down to prevent movement, move objects away to prevent injury, or administer pain medication. The right answer is to move objects away to prevent injury. Creating a safe space during a seizure helps to prevent injury to the person. How should you remove a bee stinger embedded in the skin? Your options: scrape it off with a knife, pull it out with tweezers, squeeze the area to push it out, or brush it away with your hand. The right answer is scrape it off with a knife. Scraping the stinger off helps to avoid squeezing more venom into the wound. What is the primary function of the digestive system? Your options: respiration, circulation, digestion, or excretion. The correct answer is digestion. The digestive system is primarily responsible for breaking down food into nutrients that can be absorbed by the body. Where does the digestion of carbohydrates begin? Your options: stomach, small intestine, mouth, or large intestine. The correct answer is mouth. Salivary enzymes in the mouth, such as amylase, initiate the breakdown of carbohydrates. So, the digestion of carbohydrates begins in mouth. What is the function of the pancreas in digestion? Your options: producing insulin, producing bile, producing digestive enzymes, or storing nutrients. The right answer is producing digestive enzymes. The pancreas produces digestive enzymes that includes amylase, lipase, and proteases, which aid in the digestion of carbohydrates, fats, and proteins. In the event of major bleeding injury, what is the first step? Your options: apply, turn, elevate the injured limb, or apply direct pressure, or administer pain medication. The right answer is apply direct pressure. Direct pressure is the immediate measure to control major bleeding. In medical terminology, what does EEG stand for? Your options are electronic eye gauge, electroencephalogram, endoscopic esophageal graph, or enzymatic electromagnetic gradient. The correct answer is B, that is electroencephalogram. EEG measures electrical activity in the brain, helping diagnose conditions such as epilepsy and other neurological disorder. What does the abbreviation CDC stand for in the medical field? Your options are centralized disease control, clinical diagnostic criteria, centers for disease control and prevention, or cellular dysfunction counter. The correct answer is C, that is Centers for Disease Control and Prevention. CDC is a national public health institute in the United States that works to protect public health safety through the control and prevention of diseases. Which is a symptom of hypothermia? Your options: flushed skin, rapid heartbeat, shivering, or excessive sweating. The right answer is shivering. Shivering is the body's attempt to generate heat in response to cold temperatures. What should be done for a person experiencing a diabetic emergency? Your options: administer insulin, offer sugary snacks, elevate the legs, or provide fluids with caffeine. The right answer is offer sugary snacks. The sugary snacks can help to raise blood sugar levels in a diabetic emergency. Which vitamin is important for blood clotting and bone health? Your options are vitamin A, vitamin C, vitamin D and vitamin K. The correct answer is vitamin K. The vitamin K is essential for blood clotting and bone metabolism. Which vitamin is important for blood clotting and bone health? Your options are vitamin A, vitamin C, vitamin D and vitamin K. The correct answer is vitamin K. The vitamin K is essential for blood clotting and bone metabolism. What is the main function of the appendix in humans? Your options: digestion of proteins, storage of bile, immune system function, or nutrient absorption. The right answer is immune system function. While the exact function of the appendix is not fully understood, but it is believed that it plays a role in the immune system.